Assalamu alaikum everyone and a warm welcome on our today's webinar. It's a pleasure to have you all with us joining a remarkable discussion on podiatric career. As an attendee in the US, we hope this session will bring clarity, direction and confidence on navigating your future in the unique pathway of podiatric medicine. Before we begin, I would like to highlight on the organization that's making this initiative happen. Dream USMLE, founded by Dr. Abdullah Al Masud Sir in 2015, is a non-profit membership and professional organization which is dedicated to support Bangladeshi physicians aspiring to pursue medicine in the US and beyond. It offers young physicians workshop in the US, tailored career webinars, special batches for USMLE Step 1, Step 2 CK, OET, Step 3, residency interview skills, and numerous research positions, observership opportunities, and US clinical experiences. More exclusively, overall guidance for fellowship and onwards. Dream USMLE also plays pivotal roles on dedicated mental health support. It provides career counseling webinars for the UK, Canada, Middle East, and Australia as well. A quick reminder to our audiences, this session is live streaming on our Facebook group and page. Any queries about today's topic, please feel free to write it down to our comment section. We will address them accordingly. Before the acquaintance of our moderator panel, I want to pay tribute to our unsung revolutionary national hero and young martyr, Sharif Osman bin Hadi. Now, coming to our moderator panels, I am Dr. Sadia Tasnim, graduated from Sir Salimullah Medical College and completed my internship at Midford Hospital. I have been associated with Dream USMLE since 2024. I was a student at 17th Step 1 batch and an active member of Division of Advancement and Career Development Wing. Also, I'm active with the research subgroups. And now I would like to call upon my co-moderators for the session. Please, Dr. Fayaz Saqib Khan Samit, introduce yourself.
Good morning, everyone. I am Fayaz Saqib Khan. I just started my internship following MBBS from Green Life Medical College this year. I was also enrolled in the 17th Step 1 batch, and I'm currently the mentor of Career Development Division of Dream USMLE. And I'm also actively working on a research project all under Dream USMLE. I would like to now request our next moderator, Dr. Munim Hassan Chaudhry, to come forward and introduce himself. Dr. Munim.
Thank you. Assalamu alaikum, everyone. I'm Dr. Munim Hassan Chaudhry. I've recently graduated from Anwar Khan Modern Medical College Hospital and will be starting my internship soon. I'm from session 1920, and currently I'm pursuing USMLE Step 1 and enrolled in Dream USMLE 17 special batch. And I'm also involved in the career development division. And this is my first time joining the moderator panel. And I would like to sincerely express my gratitude to Dr. Abdullah Masud Sir for this wonderful opportunity. I'm looking forward to an interesting and highly informative session on podiatry with Dr. Mir Emuddin Sir. Thank you.
Okay, I would like
now,
to...
Dr. Kulsum Haq, please introduce yourself.
Good evening, everyone. Thank you for joining this podiatric session today. And I'm Kulsum Haq, Dr. Kulsum Haq, graduated from Select Women's Medical College and Hospital and postgraduate from Chester University and diabetes. And recently, I'm just preparing for USMLE Step 1 19 batch under guidance of Dr. Abdullah Al Masud Sir, and also enrolled in CK batch, and also working as a co-mentor in the career advancement and development division, and also active participant of this journal club. And Actually, I would like to thank you, Dr. Abdullah Masud sir, for arranging such a big platform, and we are really grateful to you for this uh, uh, amazing platform, and thank you. And also, we are very eagerly waiting for this podiatric session. And thank you once again, Dr. M. Mir Uddin sir, to joining us today for this session. Thank you.
And now it's time to reflect on our special guest, Dr. Mir Moniruddin Sir, MBBS from Rangpur Medical College. After his ECFMG certification, he also got certified from American Board of Podiatric Medicine and currently is an attendee and associate podiatrist in Jamaica, New York. He also used to teach medical students there. Such an impactful career, I would say. Welcome, Dr. Mir Moniruddin Sir, to our program. Hope you're doing fine. I would like you to take the floor now and illuminate us with your experience.
Thank you. Thank you very much. First, I want to thank to Abdullah Masud for giving me the opportunity to say something about the podiatry. And thank you everyone who is joining here. So I'm Dr. Mir Uddin. I'm from Rangpur Medical College. I'm the 26th batch of Rangpur Medical College, and I graduated from the Rangpur Medical College in 2003, and I finished my internship in 2004. So I have a slide. I will gonna go over this, the whole journey, how I finished this one. Okay. So maybe I'm gonna start showing my slides. It's okay?
Yeah, sure.
Can you
Yeah.
Can you see my?
Yeah, it's visible.
Okay. So I'm Mir Uddin, board certified in podiatry, food and engage specialist. And recently I joined a private company. It's called Metropolitan Food Care, New York. So this is my journey, how I started. So I graduated from 2003 from Rangpur Medical College. Then we finished my internship in 2004. Then actually I got FCPS Part 1 in 2005, and I finished 5 years general surgery training in Dhaka Medical College and PG Hospital, and I finished the course and dissertation, everything, and I was prepared for my FCPS Part 2, but at that moment somehow I come to the USA, so could not take part in the FCPS Part 2. I'm going to finish that one, then move to the USA. Actually, I got diversity visa, and I was not prepared to move. It was a very difficult decision for me. What should I do? Because I was almost finished my FCPS in Bangladesh. I moved and then enroll in the USMLE things. And we took the step 1, step 2, everything, and I got the ECMG certified in 2016. Then I tried few years, actually, residency in surgery, medicine, mostly focusing on the surgery because I like surgeries, but I could not match that much. Now you guys have a lot of mentors, lot of options to get the residency. In our time, we don't have that. And at that time, I was teaching in a school to the nurses, medical assistants, medical staffs. Then in 2019, I got admitted in the NYCPM Podiatry School in New York. Then I finished the Podiatry School in 2022 and get residency in Jamaica Hospital and Flushing Hospital. Podiatry has 3 years for residency. So in 2005 I finished the residency, and now I'm doing the job. So this is in short. my life. So this slide I made regarding like what is podiatry, what is the scope of practice podiatry, how to get enrolled in the podiatry school. This is, I would say, this is a kind of alternative to the MD. There is not much different. You are still, and say, doctor. I think it is better than the nursing or some other stuffs. So there are 11 podiatry school in the USA. Here are the list. I graduated from the New York College of Podiatry Medicine from Turin University. So how to get admitted into the podiatry school? So they have actually two entry class, January entry class and September entry class. All are like 4.5 year program. January entry class started from application starting from November 30, and September starting class application is starting from June 30. Okay, so this is the average tuition fee, how much tuition you need. So almost 37,000 is the tuition fee, but other costs also include, so average maybe 50,000 per year. It's literally not per year. It should be like, sorry, per session, it should be per session. Okay, not per year. So first year, 50,000, second year, 50,000, third year, like this. And these are the link for the New York College of Podiatry. I told you the 11 colleges are there. So this is only the New York College admission link. And you can send the email also to know more about this. For the international students, they evaluate the course by course evaluation, and you have to evaluate by the World Education Service or Educational Credential evaluations, and you need the TOEFL for that. But good thing is that if you took USMLE step 1 and you pass the step 1 within 3 years, you get a consideration of advanced standing. That means they write off 1 year and you can join from the second year. So they reduce the course in 1 year. You start from the second year. So this is the like a small presentation of podiatry, what podiatry actually do. So podiatry can do medical practice, podiatry can do the surgical practice. Some podiatrists do the both. Some podiatrists, then they don't do the surgery, they do only the medical things. Okay, so what we do, we mostly do like ingrowing, athlete's foot, tinea pedis, ingrowing toenail fungus, diabetic foot checkup, neuropathy, then charcot foot, any sports type related injury, maybe ligament injury, fracture, whatever thing, heel pain, any type of foot pain, leg pain. We manage this varicose vein treatment, conservative surgeries, we can do everything. And of some of the office-based tests we can do like nerve conduction velocity, then EMG, ABI, PVR tests. These are the office-based procedure we do in the clinic. And we also do the surgeries of the foot. We are allowed to do the surgeries below the tibial tuberosity. We cannot touch the knee, but anything below the knee we can operate on the foot. There are some states, I think New Jersey and a few more states, they allow to do up to the hip. But in the New York, we do only the leg and the foot and ankle. I mean, like below the tibial tuberosity. So we mostly do the deformities of the foots, like bunion. You see the foot here, bunion, hammer toe, curved toes and foot. So these are the post-op X-rays like this. We do the any type of foot injury, leg injury. We manage the wound and wound care, diabetic ulcer. all type of wound management we do in the foot and leg. We can do the flap surgery. We can do the skin graft surgeries. We manage the foot tumors, all the type of soft tissue and bony foot tumors we manage. We can do amputation of the leg and of the foot, any level of the foot. We do the operative surgery of the any fracture of the foot from toe to ankle, calcaneus, talus, or whatever the bone in the foot and the lower part of the tibia and fibula. We can do fixation with screw plate, X-fix, everything. Yes, we can do the ankle injury. Is a very popular thing in the ankle injury. So we manage the ligament injury, different type of reconstruction of the ligaments, different types of ligament used for reconstructions, open fracture, any open fracture, ankle fracture, foot fracture, gas gangrene we used to treat. So these are some example of the fractures that we manage. Actually, this part overlap with the orthopedics. They also do the things, ankle fracture, ligament things, but we do better than them. So this is my favorite area, minimally invasive surgery. I learned in invasive surgery in Bangladesh too. I did my laparoscopic surgery of my own grandma. So I have a like affinity to do minimally invasive surgery. So by here I expert on this surgery too. So over here, like people do the bunion surgery. You see the foot here, they have bunion and hammered toes. The people over here, they don't like the curvy toes, curvy foot. So outcome would be like this. So we can do the traditional surgery like this. We make a big incision like 2 to 6 inch incision like this, but we can do the same surgery with making small holes only, which requires only one stitch. You can see with the machine, with the jig, we cut the bone, we shape the bone and fix it. We fix it with the screw, sometimes the device. This is called minimal invasive surgery. So with the minimal invasive surgery, we can do any toe surgeries, any foot surgery, any calcaneus surgeries, even the Achilles tendon repair also can be done with the minimal invasive surgery. No incision, only making some holes and fixing it. We also do the endoscopic surgeries too, endoscopic ankle surgery, subtalar joint surgery, ligament repair, a lot of things. Another part of the podiatry is like podiatric pediatrics. So we used to see the kids for their foot deformity, any type of foot deformity. Over here, we only like bring up some common things that we see in the clinic, like in-toeing. We see the in-toeing foot. It's like another name is like pigeon foot or out-toeing foot, the duck foot. It can be because of the foot deformity or maybe because of the tibial deformity or maybe coming from the hip. So we have to find out the cause and we have to correct it by giving some brace or orthotics, sometimes surgery. And you see the flat feet, very commonly flat feet. These are the foot deformity we usually not concerned in our country, Bangladesh, but over here they concern a lot. In-toeing, out-toeing, flat feet, toe walking. If someone have like Achilles tendon problem, contracture of the Achilles tendon, they will walk as like this. A lot of kids we got it here, toe walking. So we manage this toe walking too. Different types of treatment available, conservative, surgical, depending on the severity and the age of the kid. We also manage the clubfoot deformity and a lot of other deformity also. So orthotics is like big part of the podiatry. For the conservative treatment, you can see that different types of food here. Different types of food here. This is the normal neutral food. People can have the pronated food and can have a supinated food. These are all like little bit deformed food. If you see here, neutral food, higher foot and flat feet, our arch is very important because whenever we walk, our body weight transmitted by the foot. So foot should have a good arch, but it should be an optimal arch, not the flat feet. If someone have flat feet, they don't have the arch. So the whole body weight goes on the foot. So we need to fix it. Otherwise, the patient may get arthritis, a lot of foot problem at early age. So we manage it with, firstly, we manage it with the conservative treatment with the orthotics, different kind of orthotics. You can see in this picture, people with flat feet or posterior tibial tendon degeneration, they have the flat feet. So we give the orthotics in such a way to make, it is a individualized orthotics. We measure the foot, we do the biomechanics of the foot to see what kind of deformity, what angle, and what is the degree of deformity. And we make this orthotics in the lab individualized like this, or like it looks like something like this to keep it aligned with all the joints. Okay, you see the straight line. So the orthotics make the joint align. The different kinds of orthotics. This is the foot orthotics. These are the ankle orthotics. Sometimes we use the brace, different kinds of brace, just to align the joint and foot bones to prevent the further deformity. This is big part of the podiatry. A lot of people, they don't do surgery. They just see the patient in the clinic and do these orthotic things and are making a lot of money. Okay, this is like in short a podiatry. So do you have any questions for me?
Thank you, sir, for explaining the scope of practice of podiatry in the United States. I loved how you explained the gamut of practice of podiatry, things that we see in our country that are done by general surgeons, plastic surgeons, orthopedic surgeons, all are kind of done by podiatrists in the United States.
Yes.
Can you just differentiate between the orthopedics or general medicine or surgeons or even plastic surgeons from podiatrists?
Yeah, I mean, like we are allowed to do, as I told you, like below the level of tibial tuberosity. So from skin to bone, any pathology we can manage. Whether it is wound, whether it is any skin lesion, whether it is any skin or bone or muscle tumor, any ulcer, any fracture, we can manage everything. Just our level is tibial tuberosity. But there are some states I know, like New Jersey and some one or two more states, they also allow to do above the knee and above it, like up to hip. But in the New York, we only practice below the tibial tuberosity. We cannot touch the knee. Absolutely knee, we cannot touch it. But we do like varicose vein, even because vein surgery, conservative treatment, ankle fracture, a lot of sports injury come with ankle injury. We manage those things. And all the diabetic patient, this mandatory here to like evaluate the diabetic patient for any type of problem in the foot. So diabetic ulcer, neuropathy, anything, nail pathology, toe pathology. People over here, like in our Bangladesh, we don't concern that much about the toes and the food type of food that. But over here, people are like very, very like how to say, very concerned about their food. They don't want like curvy toes, curvy food. They want to fix it. So we get a lot of people, podiatrists do a lot of bunion surgery, a lot of hemato surgeries, tendon transfer, yeah, fracture.
Are
We
these
do all
all
the fracture, everything.
are these all elective surgeries that are done that are chosen by patients who want to
Mm-hmm.
just look better?
Mm-hmm.
Are
Yeah,
these all
elective
elective
surgery,
surgery?
emergency surgery, any trauma. We do all the traumas of the foot. Open fracture, cut injury, tendon injury, muscle injury. We do all the things.
Okay, thank you. So you mentioned
And
about
as I told you,
going,
like I like the minimal invasive surgery. Nobody like a scar on their body,
yeah,
so I like it making a small hole and doing the whole things with the machine.
yeah, that looks really fun. So
Yeah.
So you mentioned about going through podiatric medical school for a couple of years and then going to residency. Is there any
Mhm.
pathway for international medical students to go directly into residency, or do they all have to
No,
go through
no,
the
no.
PIRPA?
You
Okay.
have to only few among the 11 medical school,
Yeah.
podiatry school. Only I guess one or two give you the opportunity. After passing
Okay.
the USMLE step 1, you can enter to the podiatry school. So say right up the 1 year, so you have to start from the second year. If you
Hmm.
pass the USMLE step 1 within 3 years, others you have to
Hmm.
start from the first year, and you have to have a TOEFL score too.
Yeah. Got it.
But if you
So
have
there's like,
USMLE part 1 done, you don't need the TOEFL.
so there's no direct residency pathway like
No,
for MDs. Okay, thank you.
no.
So the next question would be like, how difficult is it to match into a good residency program following medical school in podiatry medicine?
Oh, it's very easy. Like in the medicine, we are as a foreign graduate. It is
Yeah.
very difficult to get the residency, right?
Yep.
The
Yeah.
program choose resident,
Hmm.
right? But in the
Yeah.
podiatry school, if you pass the podiatry school, you choose the program, which program you want to go. Like
Oh, the
any school you pass from here, whether it is DO or podiatry, you choose the program. That I want to go this program. I want to go this program. I don't want like this program. You understand? Like
yeah.
totally
Okay.
different issue here, like different scenario. Because you pass from
Uh,
here, so
yeah.
they will give you a lot of advances. Like
Yeah.
I would say 99% match, unless you are that like any issue, other things.
So is it a very physically demanding job, or does the typical work-life balance? What does a
No,
typical work-life?
it's a demanding job. It's a demanding job. Like in our and it's very difficult too. It's not that easy. Though it is from like knee to foot, it is very difficult. I have very difficult to pass the board because their passing score here is like 70, and getting 1700 is really tough. Though I finished the USMLE too.
Okay.
You understand? They have the like
Yeah.
in like medical college, and in our medical college we have tests every week, 1 or 2. Like they have also the test every 1 week or two, and they give only two options. Like if you fail one exam, they will give you option to the second time. If you fail second time, you are out.
Mm,
So
that's very tough.
at the beginning, our school has like 120 to 130 students, but we graduated only 62. So rest of the students drop out.
Were they
So
all like
it's
American born,
competitive.
or is it were they all American born? Or is it like a filtration
No, it's
process
not
too?
like in our
It's a
class. Like
okay.
it's a New York is different. Most of them are
Okay.
like a lot of foreigner students are here.
Yeah.
I got a lot of like Bengali student also, American born, a lot of Middle East doctors, and yeah, most of them are here, American born. Yeah. But a lot of
So
foreign students also study the podiatrists.
mm, got it. So how what does a typical work-life balance look like for podiatrists? Like, is it like surgery where you have to be there 40 to 60 hours, 60 to 80 hours a week, or is it just like a bit more lax?
I mean, like you want me to school, college, or the
Uh,
residency?
n- the practice, like following residency.
Oh, practice depend on you, right?
Or is it
Like
like a
now,
private
I'm
thing?
doing the
Yeah.
job from 9 to 5. This is
Yeah.
the usual schedule, but yeah, it depends on you. You can do part-time, you can do full-time, you can do your own. You don't want job, you can open up your own business like any Mendy or any things, you know?
Hmm. And
Yeah,
what
and
about
payment, I
residency?
would say there is not much different from MD to Podiatry, you know? A lot of
Hmm.
Podiatry earn a lot of more than the MDs.
Hmm. Oh, okay. So this was my last question. So since you mentioned this, so how is the compensation like compared to
Yeah,
like other?
compensation, I would say like good, very good.
Is it like
I
comparable
mean, like
to?
it's almost it's not like same as the other specialties, but almost similar. You know, like
Since
starting, I would say starting like 150 to 200,
oh,
whereas
that's
the
really good.
medicine starting, I think 150 to 200, 250, something like that. Our podiatry starting at 150 to 200. Yeah.
So can podiatrists open their own practice in the United States and just practice there? Like they can they do just practice? Can they just practice privately if they
Yeah.
want to?
After finishing the
Okay.
residency, you don't need to go for any job. You can open up your own business.
Hmm.
But few at least 1 year or 2 years someone work with the old podiatrist because the residency you work in the hospital, but in the
Yeah.
practice you do your own
Your
business,
own
right?
thing.
So totally different scenario. In the hospital you get the patient, uh mostly the like, how to say, unstable patients, fracture, those things, injury, those things. We don't get that much diabetic checkup or like uh, very minor things, they don't get it. But in the clinic, you get everything.
Hmm.
So totally
So
different setup. So know this setup, you need to work few days with some podiatrists so that you understand how to run a clinic. But yes, you don't need to go. You can just finish your residency and you open up your own business.
okay, thank you. So how is the podiatry residency like? Is it
Product
is
residency,
it
I would say
also
a little bit,
demanding?
yeah, no, product residency, I would say a little bit easier because
Okay.
most of the podiatry hospitals, they don't do the admission unit, you know, like the
Yeah.
patient come, they don't admit. They only do the
Hmm.
consultation part. So their patient admit in the medicine department or surgery department, they manage everything. Then they call you for the food problem. So
Okay.
you don't have to see other problems. You know, it's a little bit easier life in residency.
Is it also like 9 to 5, or do they have to put you on call and do extra stuff?
So on residency,
Yeah.
on residency is like residency is depend on how many resident you have. You know how busy
Okay.
your hospital is. I used to work in a very busy hospital. Jamaica Hospital is very busy, #1 trauma center.
Yeah.
So we have a lot of patients, but there are some hospitals they don't get that much patient, so you are not that busy. It depends on the program to program and how many residents because someone has to be in the hospital, you know, so the DTR will going to be divided among the residents. It can be like 12 hours, can be like, but yeah, but it's not like, it's not burdening, okay? It's not that
Hmm.
hard like medicine or surgery or orthopedic. It's easy.
Thank you. So, are there any misconceptions about podiatry you would like to clarify to general audiences and other students who are kind of looking into this field as someone who are looking to this field who don't really know anything about it?
Sorry, I didn't get your question. What is that?
So, are there any misconceptions about podiatry you would like to clarify to people who don't really know much about the field? So, oftentimes they are like
Yeah,
so
I mean,
laser
like
focused on.
podiatry is combination of medicine and surgery, but at the level of the foot and leg. That's it.
Yeah. Okay.
Okay. So we
You're
do
able.
everything from skin to bone. Everything from skin to bone, whether fracture, whether injury, whether tumor. anything. Then regular checkup, diabetic foot checkup, wound, all type of wound management in the foot, amputation, any amputation, toe amputation, foot amputation, TMA, ankle amputation, everything we can do. But it has to be below the tibial tuberosity by the rules of government. Yeah.
I love how deep
A lot
the
of people,
scope of practice is.
and you know, a lot of people, they don't do surgery here, podiatry.
Hmm.
Okay, they
They
just
just
see the patient, medical conditions, and treat and stick with the orthotics. Orthotics is very good compensation, you know, like same as the surgery. You do surgery in 3 hours, the amount you get paid, and the orthotics give you the same amount. It takes only 5 minutes to give a prescription, you know. So good.
yeah, it does
I would
seem
say it's
very
a good
enticing.
alternative.
Yeah,
And
it does. It
yeah,
does sound really good, and the
yeah,
scope of practice
and
is so
life
deep.
work balance is very good.
Yeah.
You know, you don't have to be worried like what happened to the patient. There is not that much difficult or critical patient in podiatry unless it is gas gangrene or something like that. So that not much, like we don't have that much emergency patients. Only few wound with gas gangrene or open fracture. These are the need immediate concern. Other patients, they are stable patients, so you have time to see the patient, even in the residency
So,
too.
did your experience in Bangladesh help you out during residency or in medical school? Because you did work quite a lot of years working in Bangladesh.
What? What is
Uh,
your
did
question?
did your experience working in Bangladesh help you in residency
Oh
and in medical
yes, of
school?
course, of course. Actually, I did 5 years. You know, as I told you, I did 5 years fellowship training in Dhaka Medical College and PGI Hospital. So and I was different resident at that time. You know, I was just doing surgery. Sometimes I did more surgery than my whole unit. I was like fond of surgery. The whole night I do surgery like that. I never get tired. So yes, I have weakness to the surgery, and that's why I choose another course. I choose the podiatry, and when I like doing the surgery, I literally teach my attendings how to do the surgery. Really, yeah.
Yeah, that would have
Because
made
they
you
are
a
not
huge
exposed that
asset.
much. They are not exposed that much. We did
Yeah.
like thousands of surgery in Bangladesh, a lot of surgery. As I told you, I did my grandma laparoscopic surgery with the machine. So I have a lot of experience, a lot of like skill. They don't have it. So sometimes I help them to how to do this thing. You do this with better, you do like this with better, like this. Yeah.
So any program would have been lucky to have you with them.
Yeah. I don't know. Like,
So last question to you would be, so what mistakes do students commonly make when pursuing this path?
podiatry.
Yeah.
I don't see any mistakes. Like it depends on what you want to do. I didn't spend too much time to finding the residency, but like nowadays we have a lot of Bengali attending in different hospitals. It is very easy to get the residency in the medicine or other field. But in our time, like 2015, 16, we don't have that much link. We don't have that much like attending in different hospitals. And I am a kind of people like myself, you know. I don't like to go people, hey, help me do things like this. So find my own way. So I find out one of my friend, he did the podiatry. So I learned from him. Then I went to the school to see the things and I said, oh yeah, it's a good match for me. I can do the surgery too. So I get into the podiatry. And
Uh,
yes, it's good. Is I would say I like podiatry now more than the medicine. Is a easy
Thanks.
job, easy subject. not that much headache, and payment is almost same.
I also love the work-life balance aspect of your specialty.
Yeah.
Thanks to you, I think everyone listening in should have a very
The
good
only thing is
idea.
that you have to get into the school and you have to take the student loans. A lot of student loans, you see the 50 to 60,000 per year. So it's come like a lot of money. But believe me, it's not that money. All the students here, they took student loan, and it is very easy to pay. Once you are finished the residency things, it is very easy to pay. Even you can pay it in 2 to 3 years. That's it, if you want.
Thanks to you, everyone listening in should have a very good idea about what being a podiatrist entails in the United States and how can a Bangladeshi person pursue this pathway.
Yes.
Does our other moderators, Dr. Munim Hassan Choudhury and Dr. Kulsuma Haq, have any questions for our wonderful guest?
Yes, I have a question. How important is research for matching in top podiatry residency programs?
It depends. Actually, podiatry residents also divided. Some programs are surgical based. Some programs are like medical based. So you have to find out which type of program you like most. As I told you, like podiatry residency, once you pass from any medical college here, whether it's medicine or podiatry, mostly you choose the program, not the program choose you. Okay, you choose the program. I like this program to go. I like this program. I like this program. So you choose the program, then you go. And you get like whatever hospital you apply, you get call from everyone. Okay, so people don't apply that much. Like 5-7 is okay. Like 5-7 hospital they apply and they got the residency.
Yes.
But whatever the hospital you apply, everyone will gonna give you the interview.
Okay. Sir, how is collaboration between podiatrists and orthopedic surgeons structured in US hospitals?
What is the question?
How is the collaboration between podiatrists
No, they are
and
good. They are good. The collaboration is very good. They basically don't go below the ankle right now. Very few of the orthopedics they do the ankle. No, ankle actually orthopedics also do the ankles, and we podiatry also do the ankles. Is like overlapping here, but they don't touch the foot. So any foot injury, foot trauma, foot pathology, anything, we manage the foot. And ankle area is like we overlap each other. Yeah.
So that was my question. Thank you, sir.
Dr. Kulsuma Haq, do you want to ask any question to our wonderful guest?
Yes, thank you. Thank you, sir, for this wonderful session and interactive session. Actually, I have a question regarding as a fresh graduate, do we need any if I want to do processing from Bangladesh, do I need any that's like IELTS, minimum IELTS requirement or OET requirement? Or is there any ECMG certification or like what are the base requirements
Okay,
for
so
this
base requirement
podiatric?
as that if you want to get podiatry school, then you are a international student. For the international
Yes, sir.
student, you can enter as an international student as a first year, and you need the TOEFL, and you have to verify your certificate with the link I sent you. Certificate to institute, they verify the certification, right? So you have to send all the certificates application. You have to submit to one application to 2 or 3 letter of recommendation from podiatry. Then you can get in the first year as a first year student. But important and good thing is that if you have done USMLE part 1, within 3 years you can get into the podiatry school, and you can skip the first year, and then you start with the second year podiatry.
So I have a question, confusion regarding that. Within 3 years means that after the
I mean, like
graduation,
you,
within
like you pass the step 1, and next 3
yes,
years you have option to get admit into the school. It is only for
okay,
the newer podiatry school. I have no idea about the other school. The school I passed from is New York College of Podiatry Medicine. They have this option to take the USMLE grades. Okay, I have no
so
idea about the other state podiatry school.
okay, sir, thank you. And
So
one
you
more
can skip
question.
the first year. And first year, I heard the first year is difficult for them. A lot of people, a lot of students drop out from the first year.
Okay, sir.
And as I told you, we had like about 130 student, and we graduated 2022 batch only 62 students. So rest of the students are dropped out. There are 3 boards we have to take on podiatry school. Yeah, you have to pass the
Okay.
board to go for the from second year to third year, something like that. And
And
you
one
can
more
take the
question.
test only 2 times. First time you fail, they will give you
Okay.
another options to pass the next time. If you fail in 2 boards, then you cannot proceed. You will be
Continue
dropped
the
out.
study. Yeah. Okay.
Mhm.
One more question that regarding the uh, study curriculum. Is this similar like that our medical school, or is this like research based exam
No, almost same, like
like
medical.
our
But
medical curriculum?
in over here, like I would say, uh, same, same, yeah. But in our country, we mostly study like different things. Over here they used to teach different things. Like our
Okay.
study materials is different. If you read the
Uh,
USMLE, it
okay.
correlates mostly with the USMLE stuffs. Okay,
Okay.
but
Uh,
yes, the anatomy is much vast than we used to study in medical college, right? Because it is only
yes, sir.
small foot and leg. So anatomy is like micro anatomy. They will teach you micro anatomy of the foot and the leg.
Study type is different, but the system is similar, like our medical curriculum, not like research based or something, not like that. Like sir, and
No,
how
same.
exam for like we attended our professional exam in medical school, right?
Hmm.
That it was before 3, now it was 4. Then here
Hmm.
exam it's yearly or like how the exam is
No,
uh,
over here, I mean,
mm,
like they have like subject-wise board, subject-wise test.
okay,
So like, yeah, they took the classes on different topics. They the same as Bangladesh, no? Those things. They
okay.
take you the lecture, and they will take the test. And after that, they will take the test on whole subject, something like that.
Is there any
But the
differentiation
like
like
difference is that we used to study in Bangladesh like unnecessary things, you know. But over
okay,
here, everything is specific, and it's really a little bit hard because like passing mark is at 70. Suppose
okay,
you did bad on first test. Suppose you got 50. So you are 20 points back. So next 2 tests, if you have on the same subject 2 tests, so you have to cover
second
these
test,
20 numbers. So 70 plus 20, that means you have to get 80 on both. You understand?
yes,
So now it become very hard to pass the topics. And if you fail 2 times, you are drop out.
okay,
So from
got
the
it,
beginning,
sir.
you have to be like up to the point. No, again, it's very easier to like first test you got 90, so you are already ahead of 20 points. You understand?
Okay.
So it helps for the in average number. So average you have to get 70.
Okay, the pass mark is up to the 70.
70, yeah.
Okay.
And the tests are
One more.
really hard tests. Is almost like USMLE tests.
And one more question that
Mhm.
regarding that is there any different like you explained on your some that mm, the study cost is around per year 50,000 per year. So is there any difference
No, it's not actually
between the
per year.
US
I would
resident
say
or international student?
yeah. What is the question you said?
That as a US resident, like those who are entered in US in another route, like family visa or spouse visa, is there any difference between the as a international student or the
No,
resident
your
student?
international student as your study base. You know, you're showing
Okay.
all your certificates from Bangladesh. So you
Yes.
ultimately become a international student. You are not finishing your school or college here in the USA.
Yes, sir.
So whenever you are submitting your application, those
Okay.
applications are from foreign college. So you are international
Okay.
students, right? So you have to follow the
Okay.
international pathway.
Those who are
Or
US resident, they also need to follow the same pathway, right?
same pathway, yes.
Same pathway. The cost will be the same.
Yeah, cost everyone has
Cost.
the same cost. Yeah,
Okay. As a Native American, also the same cost.
yeah, same cost. Everyone like you are
Okay.
when you enter you as a student. So there is no
Okay.
difference international student or local student. You get the
Okay,
same
sir.
student loan. You get the same class, same certificate, and same lectures. Everything is the same.
And one more question regarding the advancement related that the actually clubfoot in our country, like Bangladesh, we are doing only like offering the special shoes and things. Is there any advancement they are doing in USA
It depends on
regarding
like
this?
how much deformity the kids have. First, we tried the Ponsity techniques, like the casting of the foot, depending on the age and severity. Okay, and certain age
Okay.
when the deformity corrected little bit, then we give the orthotics things, and sometimes we do the surgery, we do the tendon transfer, we do the bone resection to align the bones and joints. It depends
Okay,
on
so
the
thank you.
severity and the age of the patient.
And is there any restriction between any neurosurgery related to this, like as a podiatric surgeon can do the nerve related issue also, right? Can manage.
I
No,
mean,
is
like
there any restriction?
nerve related issue, like we can do the nerve transfer, anything in the
Okay,
bone, but we have very little scope to do bone nerve transfer, right?
okay,
So usually we do the sural nerve transfer, those things, but we can do that. Even the neurosurgeon also can do that, but we have the opportunity to do that if we can. But in the
thank you.
USA, like it's not like Bangladesh. You practice or you try something. Over here, it has to be standard. You understand? Like this patient
Standard
have
guideline
these
we have to
disease,
follow. Yeah.
and you have to follow the standard of treatment. That means like the standard treatment you have to provide. You just cannot try something. If you know,
Okay, so
you can do. If you don't know, you don't do. Something like that,
so anyone want to do the practice like Bangladesh, like we are doing the clinic practice, right? So after
Mhm.
podiatric school, so anyone can start their like clinic, personal clinic. No need to search
Yeah.
for
You don't
a.
need to go for any job or anything. After
And I
finishing
can
the
do
school, no,
the
no. After
setup
finishing the school, you have to finish
the
the
school.
residency.
Yeah, yeah,
Three
yeah.
years
Once finish the
residency.
residency, yeah, yes.
Yeah. After finishing the residency, you can open up your own business, own clinic.
So
You don't
for
need to
this
go for
clinic
any job.
setup, do we need any like requirements from US government? Like
No. Once you pass the certificate, you got
Okay.
the certificate in your hand. Okay, you start doing practice.
Like I do job in Maldives as well as, so if they do want to like open a clinic in their setup, they need clinic verification and clinic verified by government. Is there
No,
anything
this is different
verification?
thing. This is different. If you want to open up the business, you have to get
Okay,
some like approval, clearance
license,
from a
yes
lot
sir.
of sanitation, a lot of things. I even don't know because I didn't open up my own business yet.
Okay, okay,
So those
understood.
things take a lot of time. Yes, this is not
Okay,
related to your podiatry or something. If anything you want to open up here, you need to get clearance. This is totally different
okay sir.
business setup. But
Thank you
regarding
sir.
the podiatry, like once you finish, the day you finish the podiatry, you can start job next day, podiatry residency, or you can start your clinic from next day, something like that.
Thank you for your nice interactive answer session. And thank you, sir, once again to
You're welcome.
joining this session today. That's all.
Okay,
Uh,
thank you.
Thank you, Kusumapu, for being inquisitive. Now we also have a few inquisitive commenters or audience members. One of them asked to you, how to apply from Bangladesh? Do we need to have green card?
Green card. I'm not sure actually. Green card
Okay.
can apply. Green card. I'm not sure
So
about that.
do
They
they
have
need
to.
to have green card to apply from Bangladesh? I think that's the question they're asking.
Yeah. I mean, like, you have to inquire. Like, different medical school has different requirement.
Okay.
The requirement I told you is like I passed from the New York
Hmm.
College of Podiatry Medicine, and over here a lot of foreign students here. And like
Hmm.
New York is different from the other state.
Yeah.
So they give you the opportunity. They take a lot of foreign students, not like other states. Okay, so in our state, like, yeah, they have the international student options too. And over here, I saw that you need TOEFL and you need to verify your certificate, same thing like that.
Hmm. Okay. So our next question is also from Zinia Nazneen. She's asking, how can an international student get student loan in the United States?
Oh no, international study you cannot get student loans. You have to have citizen here.
Yeah, I think you need a social security number for that, right?
Yeah, social
Yeah, okay.
security citizens. Yeah.
So I hope your questions are answered. And if any other
A lot of
commenter has any other
Middle East
questions.
a lot of Middle East students they don't take the student loan. They pay themselves.
Oh, okay. Yeah. Well, they're from very affluent backgrounds, so it's a bit unfair.
Yeah.
So I hope all of the commenters' questions were answered. If anyone else has any questions, feel free to ask in the next couple of minutes. I feel we're nearing the end of the session. Thank you, sir. The scope of practice and the quality of life or work-life balance is extremely enticing when it comes to podiatry, and I absolutely love that aspect of it. I would like to welcome back Dr. Sadia Apu to finish the webinar.
Absolutely enthralling experiences. I think we have now come almost at the end of our session, but before I guess there are a lot of young physicians here who would try to progress in their post graduation era. Apart from studying, any last minute advice for them, sir?
Yeah, I mean, like, we are a doctor. Once you are doctor, you are always doctor. So I saw like a lot of students, they try other things, ultrasound or nursing or those things. Ultimately, they come back to the doctor. They want to be doctor. That's it. So you have to try to get into the system. There are a lot of options,
Exactly.
but you have to try hard. And for the, I would say, like if you want to stick with the USMLE, first things you have to do, you have to do good scores. If you do good scores, you get a lot of interviews. Okay. And second things, you have to finish it as early as possible. Okay. Like more than 5 years is difficult to get the
Residency.
Residency. Yeah.
Yes.
Yeah.
Okay. Yeah.
But this is
Thank
like
you so
Podiatrist.
much,
I
sir.
would say Podiatrist is a good option, good alternative. Is like same basic lifestyle and financial things too. Only thing that
Indeed,
you have to
indeed.
study more 2 years in their school, 2 to 3 years to get the training. But I would say it's good. Like you spend 3 years to get the residency rather than you study in the college and get the certificate and their confirmed residency. No need to like move around to get the residency. Yeah.
Okay. So we have covered everything, and Dr. Mir Moniruddin sir has specifically answered all of our queries. And sir, thank you so much for your valuable time and insights and shared experiences. We owe a lot to you and our audiences as well. And thank you everyone for watching and sharing your thoughts and throughout the session. Then, if we come to Dream USMLE, if you have any queries regarding Dream USMLE activities and ongoing courses, please reach out to Dr. Abdullah Al Masood sir. I hope we all would be very happy to clear all of your queries. And thank you all our moderators today for nicely moderating with me. I hope you all have a good day and lastly, I would like to tell our audience that for USMLE Step 1, 19th Step 1 batch is running in full swing, and 12th batch for USMLE Step 2 CK is in the line, and you can anytime join in our courses. So thank you again, all of you, for joining. Assalamu alaikum.